Parents of the state's most vulnerable children say lawmakers let them down. Now they're going to new extremes to fight an insurance company saying they are denying coverage. A WCCO investigation found private insurers, Medica and Health Partners, stopped fully covering nursing care. That left families who need registered nurses in their homes to keep their kids alive scrambling to find other options. A measure at the state legislature to help never got through. Now, desperate parents are taking things to the next level. That's Pluto. Chase Walter has a major interest in the planets and a minor interest in food.
Chew, 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 and then a drink.
He gets most of his nutrients through a tube because of his trach that has to be monitored.
So
it's got to be monitored, that trach.
24 hours a day.
I got one more.
Just like Reese Erickson.
Nursing is huge in keeping her home, keeping her stable.
That's why both the families took out extra insurance. Medica and Health Partners have been covering the $1 million a year care, but stopped, saying state law only requires them to provide partial care. The families had some lawmakers behind them.
There are about 250 families across the state with kids with complex medical needs who are counting on all members of the legislature to stand up for them and ensure insurance companies are held accountable.
But they didn't get the support they needed.
And I just went into the bedroom and sobbed for a good part of the afternoon.
Remember this one?
Just
Tap it.
heartbroken for all these families. It's crazy and terrible. I don't know how it happened.
So what next?
Well, we filed our complaint against Medica this past week, and they have 21 days to reply. And we have asked for immediate injunctive relief from the judge. And so we just need this coverage reinstated.
The lawsuit is not for damages, just for change, saying the statute says clearly the words shall cover mean shall cover without limitations. In the meantime, they have a huge care and money deficit to figure out.
Chase qualifies for 4,400 hours of home care nursing per year. Medica is now covering 240 hours per year, 3 weeks of coverage.
Why go the lawsuit route?
The longer this goes on, the more harm will be done to all of these kids.
Okay, you can see joining me live right now is Brandon and your attorney, Mike Rothman. Thank you both for coming in. Brandon, I want to start first. You told me you didn't want to do that. You didn't want to go this route.
No, and we just had no other option. Our son Chase was being harmed. Many other medically complex kids in the state were starting to be harmed, and we just had no other choice but to go this route.
And Mike, why did you want to take this case? It's complicated. I learned that by my investigation.
Well, complex cases are important cases. For the children whose lives are at stake, this is so important to try to get the law enforced like it should be. The law is clear. There's home care nursing services mandated by the private insurance companies to pay for kids like Chase. And we need to go to the court now because the legislature and the state agencies didn't enforce the law. They fumbled it, and now we need a court to decide it and enforce it for us.
So that would be sort of setting a precedent?
It'll establish the law as interpreted and precedent for not just Medica, but all other health insurance plans, companies in the state of Minnesota.
Okay, well, we know this specific suit is against Medica. Not Health Partners, but Medica. And I want to pull up really quick. We have a graphic of Medica did not respond to me when I asked them their response to this lawsuit. They gave us this lengthy statement right here, though when we initially told them about our investigation, they say that they reevaluate their benefits every now and then, and they said they looked at this and they believe these children are already covered by federal care. And Brandon, you read that, you've crunched the numbers.
Mm-hmm. Yeah, it's just that's not the intent. This was established back in 2010. The legislature passed this mandated coverage for children just like Chase, who have these medical complexities, who are on medical assistance. He checks those boxes, and he needs this mandated care to live safely at home. Otherwise, Chase and these other kids would most likely have to live in a hospital.
And this all goes back to a 2010 statute that was passed. And what was interesting to me when I looked at the lawsuit was there was words that were being appears interpreted differently now, because it says they shall cover, but they're now saying we will cover partly. So where does that come in, that language?
The law is clear. It says that the private plans shall cover these benefits. There's no wiggle room. There's no way to shirk that responsibility. They're trying to. And what it means is that the private plans must pay first. They have to pay before any other backstop, any other state or federal backstop. And the reason is that the legislature passed this law specifically to require the health plans to pay first. And they're not doing that. There's no wiggle room. They're not allowed to put a cap into place, which they're trying to do, which is why we have to have the court enforce this so that they pay the coverage for Chase and the kids like them.
And what's your thought on why all of a sudden the change of coverage?
Yeah, since 2010, Medica has paid all this time without changing it. For some reason, and for this year, Medica made a decision to do that. I've looked at some of the evidence. I've talked with state agencies and looked at perhaps why. The only thing I can see at this point is that Medica has chosen to keep watch over its financial profits over the benefits that they're supposed to give to these children. And there's absolutely no reason why the law should be changed or interpreted, or Medica should shirk that responsibility.
And we know Medica has again said that, hey, there's federal coverage for this. I know you're saying that's limited money, so that won't stretch over all the nursing care right there. So we have Medica's full statement on our website right now. But in closing here, what's the next step legally? What are we waiting for?
We're hoping for a quick decision by the court to issue an order to declare that Medica is violating the law and that it has to start paying the benefits for these children.
And that would be immediate relief?
As soon as we can, yes.
Okay. Thank you both so much for coming in.
Thank you.
Thank you.
Appreciate you so much.
Yeah.